Thank you. Barbara Keeley.
Thank you, Mr. Speaker. Well, today we've heard from many honourable members about the disastrous impact of this government's relentless and short-sighted cuts to council budgets. From Hull to Westminster North, from York to Nottinghamshire, from West Ham to Lewisham, from Birmingham to St Helens, from Sheffield to Exeter, Burnley and Hartlepool, Tyneside, Chesterfield and many others. And nowhere, as we've heard in this debate, has this disastrous impact been felt more acutely than in social care. And can I just start, Mr. Speaker, by congratulating my honourable friends for Hull West and Hessel and Crewe and Nantwich, whom you heard as well in the last hour, present such powerful stories about family carers and about the role of care staff, the absolutely vital two parts of the backbone of social care. Now, social care is one of the most important pillars of support for vulnerable people up and down this country. And I do want to start by paying tribute to all our dedicated, hard-working care staff, many of whom are in this dilemma that my honourable friend has just talked about. And it's sad that we're in a situation of cuts to care staff and them having to go on strike for their pay, because many care staff go above and beyond in the most difficult of circumstances to make sure that older people and disabled people get the help they need. And without them, let's face it, without these staff, we think a lot about NHS staff, but without our 1.4 million care staff, the care system would simply collapse.
Absolutely.
And my honourable friend, the member for St Helens South and Wiston, also raised the crucial issue of the fact that there are 110,000 vacant posts in the care workforce. It's deeply concerning that that vacancy rate is as it is, because it makes the situation for the staff who are doing the job much, much worse. Now, I believe, Mr. Speaker, that the government should be shouting from the rafters about the value of social care, but instead, for most of the time, there's been a wall of silence. It's only getting this Opposition Day debate today that has enabled us to raise it, and there's been very little else covered about it. And my honourable friend, the member for Redcar, talked about the vacuum around government policy in social care, and she's right to do that. Ministers seem not to want to talk about a vision for social care, following what's not surprising, I guess, the government's litany of broken promises about reform. And let me just touch on some of those. They dropped the cap on care costs due to come into effect in 2016. We had legislated for a cap in care costs, and that's left thousands of people unexpectedly having to pay for their own care. Then at the general election in 2017, we had the so-called dementia tax, a disastrous proposal which lasted only 4 days before it was abandoned. And I have met family carers still desperately worried about that policy because they think that policy is still around. Now, more than 2 years after promising a social care green paper, with the hope of some better support for families across the country, this government is still no nearer to fixing the crisis which it has made. Let's not be in doubt about it. This crisis has been made so much worse since 2010. Now, we were told there would be a green paper in summer 2017 and then by the end of 2017, but it never arrived. It was then delayed until summer 2018 and later autumn 2018. Winter came and still no green paper. The Secretary of State told us at the start of the year it would arrive by the 1st of April. It has not arrived. There is still no sign of the green paper. Perhaps the Minister is going to tell us when we are going to see this green paper. But now, when councils need an extra £1.5 billion to close the funding gap, what this government has offered is derisory short-term funding. Last winter, the government offered a measly £240 million for adult social care for winter pressures. Now, that would only pay for 3 months of home care for the older people the Secretary of State said it would help. But that's not enough. It was hardly enough, Mr. Speaker, for the harsh conditions of last winter, which, if you remember, lasted very much more than 3 months. This year, councils will receive a further £410 million to be shared between older adults, working-age adults and children's social care services. So now the Secretary of State is leaving councils and councillors with making the invidious decision of choosing between caring for the most at-risk children, vulnerable adults with disabilities and our most frail and isolated older people. And throwing small, one-off pots of money at this problem every year will not deal with the crisis in the long term. As my honourable friend for St Helens and Wiston said earlier, it's a sticking plaster on a gaping wound. Yeah. Briefly, yes.
I'm very grateful. Would she set out what is her preference for how we should pay for long-term care?
We get to this every time we have a debate on social care. We don't have many debates on social care. Members from the government side who have no ideas whatsoever. I have just run through all the abandoned ideas and the abandoned promises that the government has made on Green Paper. And I'm really surprised that any member opposite actually has the cheek to stand up and ask this side, the front bench on this side, what we would do. We laid out what we would do in 2010. We had a white paper, not a green paper. We laid out all of our proposals in our manifesto. We are the side with ideas, with proposals on taking forward social care. This government has no ideas and no vision whatsoever. And I'm amazed that an honourable member really has the cheek to do that.
Very kind of her. It's very kind of her. I spoke in the debate and I said that we have some very difficult decisions to face. We need to be open with the public. And I said we need to look, for example, at equity in residential property. I think it's unavoidable. Does she think we should do that? I said that earlier. Does she think that?
We have laid out our proposals. We said how we would fund them. And as I say, I think what we're debating here today, most of what we're debating here today is the short-term crisis. Once we get past the short-term crisis, I think the honourable member would have difficulty. I mean, there's been talk about involving the public in this. The public at the moment are faced with the type of care that my honourable friends have discussed and debated, and care staff in the workforce in the situation that it's in. We're in no point in the middle of a crisis to be talking and saying to the public, use the value of your property, let's go for this type of funding or that type of funding. That is cloud cuckoo land. I wonder if the honourable member just listened to my friend from Hull West and Hessel talk about that absolutely crucial example. What would he say to those people who need care? I think that's the question for him to answer. Now, councils need sustained investment that undoes the damage of years and austerity and cuts. But the government's choice, he's sitting there smirking at me at the moment. The government has made a choice to pursue ideological cuts to council budgets that have seen £7 billion lost from adult social care spending since 2010. Let's have a think about what that has meant. That has meant 400,000 fewer people from getting publicly funded social care between 2010 and 2015. 100,000 fewer people getting taxpayer-funded social care in the last 4 years alone, and 90 people per day dying before they receive the public social care for which they've already applied. It is not simply either the most disadvantaged who are losing out. Many of those who are having to foot the bill for their own care are being exploited by a broken care system where private care providers can act with impunity, where vindictive care homes can evict older people whose families dare to complain about their standard of care. And that's a very serious matter when we've had and discussed in this debate the level of closures of care homes and the loss of care home beds, as touched on by my honourable friend, the member for Chesterfield. And the honourable member for Totnes also talked about being in a part of the country where it's impossible to get care, and that is the position. So if care home owners can evict older people, that's a drastic situation. And opportunistic home care agencies are overcharging vulnerable people for care visits, which are too short and endangering their health by forcing staff to work when they're sick. We heard about the care staff who were too scared to take time off sick. Now, I want to make clear to honourable members the human impact of not getting the right amount of support, although those that have bothered to attend this debate, particularly those opposite, might have heard some examples. Simply put, it means people going without the support which they need to live with basic dignity. Not having needs met means going unwashed and undressed. It can mean waiting for hours to go to the toilet because there is no help available. It can mean going thirsty because there is no one to pour you a glass of water, going hungry because there's no one there to prepare you a proper meal. This is the experience of many thousands of older people who are going without care or who have insufficient care. And I'm glad to note that many honourable members have talked about a care visit being the only contact for many older or vulnerable people have in the day. And the consequences of inadequate support in the community for working-age people are also horrifying. In recent months, we've seen many reports of vulnerable autistic people and people with learning disabilities left to languish for years in private inpatient units. vulnerable, detained, secluded and neglected in long-stay units. These units, many of them private, are funded by the NHS at great cost to the taxpayer because councils simply have not been given the money to move people from these units to be supported nearer to home. And that's an issue we've had in this debate raised by my own friend, the member for Stroud, and the right honourable member for North Norfolk. Mr Speaker, I have stood at this dispatch box before and called this a national scandal, and I make no apology for doing so again. And back to government promises. After Winterbourne View in 2011, this government promised to close inappropriate units for good within 3 years. By 2014, it didn't happen. Indeed, 8 years later, there are still 2,260 people detained in hospital settings when they needn't be there. The number of adults trapped in these units has reduced by only a fraction. Worse still, Mr Speaker, the number of children in these units has actually increased. Mr Speaker, where this government, Conservative government, has done nothing, Labour will act. Rather than years more cuts, we will invest £8 billion in social care. Yep. Rather than 90 people a day dying, waiting for care, we will provide more people with the support they need. Rather than care staff being pushed to the brink, we will pay them a real living wage. Rather than more delay, we will build a national care service that supports older and disabled people when they need it. This is our message to people across the country desperate for care and support, young and old. A Labour government will give you the support that you need and the support you deserve. And that's why I urge members to support our motion tonight.